Hello everyone, I'm Sharon Norton and I'd like to introduce you to our claims team. Denise Webb and I process the majority of the trainer grant claims, with Denise dealing with Surrey and Kent and myself dealing with Sussex and Kent. We do ask you though initially to please send your claims to the generic CPD inbox below, so that in the event of Denise and I being absent for any length of time, someone else in the team will be able to deal with your claim. This may well be either Dawn or Ellie, but the whole team is familiar with these claims, so there will always be someone there to deal with it for you. The purpose of the process is to simplify everything for you, to just try and make it easier for everybody to complete the claim form. And we have tried over the years to simplify it, and we do believe that the current system makes it relatively easy. But we're always open to suggestions for improvement, so we don't mind at all if you wish to email us or speak to us about anything that you feel would make it even better. Obviously we want to make it as easy as possible for all practices to deal with this. So we will now be sending a claim form for each separate 4-month training period. So that will be August to November, December to March and April to July. Now with the August claim form, which you will be receiving soon, we will also send the SLA to cover the new training year.
Please make sure when completing your claim that you use the correct claim form. This will be the one that we send you at the beginning of each claim period, and that's the one that you should be using. Please don't use one from a previous period, as they do vary slightly. The first box is where you'll need to fill in your practice name and address. Here is where you'll fill in the invoice date. However, you can leave this blank because we will fill it in for you if you don't. This is the most important box to complete on this page. Your bank account details are very important, and any errors here could result in delay of payment of your claim. Please also note that payment can only be made to the practice account and not to a named individual. This is the box where you put the total value of your claim, and the most important thing about this box is that it must match the total on the second page. This is the part of the claim that confuses people the most, but if you have any queries on filling it in, then just contact Sharon or myself and we'll help you. The first part is for the current period that we've asked you to claim for. So in this instance, it's April to July this year. So here is where you'll list any ST1s, 2s or 3s or foundation trainees. After that, you'll then need to list your remote trainees for the current period. Okay, now this is probably the most confusing part for most people, and this only happens in the claim period April to July every year, and this is where you will put in anything that you haven't claimed from the previous year, and also if you've been awarded any uplift, which we will tell you about, this is where you claim for that as well. And in our process notes that come with your claim form, we will tell you how much it is per trainee per month. To complete your claim, you just need to fill in the signature and the date box. The signature doesn't need to be handwritten, this can be typed. The claim must be in Word format and returned to us by email at our generic email box, which is cpd.kss@hee.nhs.uk. This is your service level agreement, and you will only receive this once a year in the period that starts the educational year. So that will be August to November, and you'll fill it in, and that will cover you for the whole of the following educational year. And on this you need to fill in the practice name and address and list all the trainers in your practice. You'll need to fill in their equality and diversity training dates, and then each of them will need to hand sign at the end of the form and return to us.
Any uplift to the trainer's grant is decided nationally, and this can be at any point during the financial year. We have no control over when the uplift is granted, but to make things as easy as possible for you, as soon as we've been told whether there is going to be an uplift, we will tell you in the next available claim period how much you can claim per trainee per month and the period you can claim for, and there will be space on the claim form for this. Next, we come to some of the most common issues with the claim form. Firstly, with the SLA, we often find that the SLA is not returned with the invoice. We do need this, it's really important, because we can't send the invoice for processing and payment without the SLA. And you also need to make sure that it's completed in full and signed by all trainers and clinical supervisors in the practice. With the trainer grant, sometimes the CPD payments aren't included on the claim, so it's important that you claim this for every trainer in the practice, not clinical supervisors though, as it doesn't apply to them. We often find that the amounts don't match on both pages, so this is important to check that they both agree. Sometimes the dates of the placement aren't correct, so again it's important to check these. Sometimes the claim form isn't signed. We need to have a signature because you're taking responsibility for this claim. And we often find on the April claim form that the uplift isn't claimed, so it's important to do this as well. Overlap forms also need to be sent to us, completed and approved by your patch associate dean. So if you have any overlaps in the practice, these need to be approved before we can send the claim for processing.
Here we've added a list of the main things to remember when completing your claim, and probably the most important thing to point out is that we don't have access to the information on who your trainee placements are. We do have some emails asking us to check who you should be claiming for, and we don't have access to this information. It's the practice's responsibility to tell us who they're claiming for. We hope this presentation has been useful and made the claims process clear. But if you have any questions about the claims process, we're always happy to help and will answer any emails as soon as we can. We're also happy to receive suggestions for improving the way we do this, so please don't be shy if you have any ideas you'd like us to consider.